Good morning, everybody, and welcome to the public board meeting of the Care Quality Commission. And for those who are watching on catch up, this is the meeting of the 25th of June 2025. Um, and it's a great pleasure to be here chairing this board. I'll come to that in a minute. There are a number of new faces around the board table today, so we're going to do quite an extensive round of introductions in just a minute, but I'll start with the apologies. Three of our non-executive directors were unable to be here today. That's Kay Boycott, Michael Meyer and Ruth Owen. And four from the executive director team, James Bullion, Chris Sagiti, Joyce Frederick and Jackie Jackson. So those are the apologies. Then the welcomes. Can I welcome Diane Horsley, who's here with us in the room, with our Gender Equality Network representative. And then online, we've got Suze Cheska and Dee McAvoy, who are also attending us as the trade union leads. And they're going to both be on Teams today. So I think without more ado, can we go into a round of introductions? I'll start with myself and then go around the table. I'm Mike Richards. Once upon a time, I was here as Chief Inspector of Hospitals. That was between 2013 and 2017. I then thought I was retiring, but I clearly didn't get that right. And back last autumn, I was invited to come and do a review into what had gone wrong within CQC, and in particular why things had gone wrong. And then after that I was asked if I would at least put my name forward to be chair, and I'm delighted to have been awarded that post. So I started on the 1st of April of this year. That's enough from me. Julian.
Thank you, Mike. Good morning, everyone. Julian Hartley, Chief Executive CQC for the last 7 months. Thank you.
Good morning. I'm Nimali De Silva, Director of Legal Services.
Good morning, colleagues. Esther Provins, Interim Chief Digital and Data Officer. It's lovely to see you all here today.
Morning all. Aaron Chopra, Chief Inspector of Mental Health. I started last month in the organisation. I'm a consultant psychiatrist by background, been a consultant psychiatrist for about 20 years. The last 5 years I was the Medical Director of the Mental Welfare Commission for Scotland, which is an assurance organisation of mental health services in the north. Really looking forward to working with you all and with wider colleagues throughout the organisation. Thank you.
David Croysdale Appleby, Non-Executive Director for the last 2 years and Chair of Healthwatch England.
Morning, Chris O'Shea, Director of Finance.
Good morning, I'm Melanie Williams. So I'm also a Director of Adult Social Care in Nottinghamshire and immediate past President of ADAS, and I've worked in health and social care all my career, and I'm really pleased to be here on the board. Good morning, everybody.
Good morning, my name is Chris Day, Director of Engagement for CQC.
Good morning, I'm Aidan Fowler. I'm Interim Chief Inspector of Healthcare at CQC.
Suzanne Cohen, Director of Performance and Delivery.
Good morning, everybody. Alex Kafetz, newly appointed Non-Executive Director at CQC, background in the NHS and the public and private sector in data and digital projects.
Hi, I'm Chris Badger. I'm going to be the Chief Inspector of Adult Social Care starting in September, and I'm currently the Executive Director of Adult Care Services at Hertfordshire County Council. Really pleased to be here and looking forward to working with colleagues.
Hi, I'm Diane Horsley. I'm the co-chair of the Gender Equality Network.
Hi, I'm Sarah Vellerton. I'm the Senior Corporate Secretary and the Team Leader of the Secretariat.
Morning all, I'm Steph Tarrant, Chief of Staff.
Thank you all for that, and maybe just online to see if that's working. Dee McAvoy, do you want to introduce yourself?
Yes, hello, good morning everybody. Really happy to be here. My name is Dee McAvoy. I'm the lead steward for the Royal College of Nursing at CQC, and I co-lead with Suze for the 6 recognised trade unions here. Really happy to be here.
And next, Suze Cheska, can you introduce yourself?
Hi, it's Suze Seska, no accents on it. I am the lead rep for Unison, one of your biggest unions, and alongside Dee McAvoy, as she said, we co-lead the joint trade union side at CQC. Pleasure to be here.
Thank you both very much indeed. The next item is about declarations of conflicts of interest. I will give my own in full now, but all the rest will actually be recorded in the minutes. I have been assured, and I've looked through, none of them are relevant to today's meeting. But just so that people know, I chair the UK National Screening Committee, which recommends to the governments of all 4 UK countries what screening programmes there should be. I advise NHS England on diagnostic services. I've recently been chairing a commission on palliative and end-of-life care, and I am a senior counsel at a small company called Incisive Health. So that, I think, all the rest will be recorded in the minutes. So, I think any urgent business, I don't think we have any urgent business, but we can come on now to the minutes of the previous public board meeting. The minutes we have, obviously I was not at the meeting, so I'm not in the position, but just to remind people, there was extensive discussion of the IT review, and we will be coming back to that. Julian spoke about the organisational priorities, that's on the agenda too. We talked about anti-racism, the local authority assessments, the performance update, the disability network, people and culture, mandatory training, and the public inquiries, and they're all itemised in the minutes. Just need to ask people whether there were any points that they know were inaccurate in the minutes, or any other matters arising that won't otherwise be covered in our agenda today. If not, that's good, but there is the action log, and we'll just go through those. I think we can get through them quite speedily. There's the first one was the response to the Ofsted inquest, and that's going to come back to us in September. Then there was the item on RES and WDES, which again, all of that is going to be covered in line with the CQC way, and we're going to talk about that in a minute. The third item of the action log was about the National Maternity Inspection at the end of programme report. Now, I think everybody will be aware that maternity is an extremely high priority, both in terms of how services are delivered across the country and whether they are or not meeting the needs of families. But importantly, that also applies to CQC and how we do our inspections, and I'm going to be taking a personal lead on that for CQC, and that will also apply to the next item, which was about MNSI, the maternity and neonatal investigations, and that clearly we need to look at as well to see if we're doing things as well as we can. There was also an item on FOI, but Chris, I think that's coming back to the September meeting. He's nodding, that's good. The performance report update, again, all of that is in hand, unless Suzanne, you had anything to say on that?
No.
Okay, and then the People and Culture report, again, that's coming back into the board in September. And then finally, the mandatory learning update, that's going to be included with quarterly reports in future, so we can close that item and deal with it in that way. Any points on any of those things on the action log that people wanted to question or make comment on? If not, that's very good. So we now come to the priorities programme update, and we're also going to give some feedback from yesterday's private board meeting there. I'll just cover the items that we dealt with there, and then I want to come to Julian and Esther and maybe others to comment on a bit more detail. We had obviously quite a lengthy session of introductions, the new board getting to know each other. We then really did emphasise the CQC way. That was probably the longest single item yesterday, and that Julian will pick up in just a minute. The issue of the IT problems Esther went into, and she'll follow up on that in just a minute. And then there were other items on the immediate actions and the foundation fundamental improvements that we need to make. So that again, those are on the agenda. And then also just to say, we had a discussion about a governance review, which we are now getting underway, and there will be more on that in the future. But Julian, can I hand to you now to say something about the CQC way?
Thank you very much, Mike. And perhaps just to start by saying, really good to have new colleagues around the table. We spent time yesterday at private board talking about and updating new board colleagues on the process that we've been through around developing our shared purpose, our values, behaviours, vision, and how we, the commitments that we make to those that we regulate, all of which I think are critical in the context of the sort of reset of CQC, the focus on culture and improvement, and the way in which we engage and support all of our staff in the organisation to do their very best and to realise their potential to make a real difference to people that use services and support providers to improve. So I think we had a good session there where we took colleagues through all the work that's happened over the last several months, particularly all the engagement events, all of the feedback, all of which will come together and be distilled into our clear shared purpose, values, behaviours, and so on. We're aiming, Mike, you and I, to launch that on the 10th of July, which will be for our colleagues who will see then and have an opportunity to be part of that activation. So more to come on that, but I'm really pleased with the response we've had, and I want to thank everyone in the organisation and indeed many of our providers, experts by experience, or the range of groups that we've engaged with over the course of the last few months to help support the work we do in order to help CQC improve and be the regulator that we want to be. So thank you. Would you like me to move on to priorities and programme update?
You can do that, and then we'll go to
Esther.
We'll go to Esther.
So, colleagues, in the pack you can see an update on our priorities programme update. That gives an update on our 4 immediate actions and our 5 foundational improvements. For ease of reference, there's a couple of infographics that give a sense of progress against those immediate actions. And as you can see, in terms of those 4 immediate actions on blocking stuck assessments, we've cleared 480 of the 500. The remaining 20, good reasons why those remain there for various technical issues and legal reasons. But that, I think, is good progress. And work underway, obviously, to get those through as well. Enabling new assessments. We are working hard to deliver against a trajectory to deliver more assessments, and we've set ourselves that target of 9,000 over the next 18 months and making progress against that. We're on trajectory for that, and we're looking at, particularly with our new chief inspectors, joining how we can do even more to maximise our effectiveness in relation to assessments. On the backlogs, which was a particular concern when I appeared in front of the Health Select Committee, we've been able to reduce that static cut that we reported to the committee to zero, which is good news. And of course, we need to keep on top of this on an ongoing basis to make sure that we don't allow any further backlogs to develop. And actually, just to say, I was very, it was great to spend time with the National Customer Service Centre last week in Newcastle, and indeed to have the benefit of joining colleagues on the work that they do, to see firsthand just the scale and scope of the activity there. So thank you to all colleagues in our National Customer Service Centre for working hard to get on top of that. And on registration, more work to do here. I think we do want to get that percentage of 35.2% down, and we are looking at some pilots to effect change to reduce perhaps the time it takes to register new providers, which we know is such an important issue for many of them. So good progress on those fronts, although obviously not complacent, still plenty to do. On the foundational improvements, and I'll just cover these off and then hand to Esther, particularly on the IT issue. On operations and regulatory leadership integration, we were very pleased, and I want to thank Dee and Suze and all trade union colleagues for working effectively with us on this. But we have now been able to bring together the inspector and assessor role, which I think is very important in the context of being able to maximise our capacity for assessments, inspections and so on. Delighted to report that we have now appointed all 4 chief inspectors, and obviously Aaron is with us, Chris is round the table, and both Bola and Tolly were able to join part of our discussions yesterday, so that's good. And I also want to pay tribute to Aidan, who's been doing a fantastic job covering the whole range during this period of work that we've been doing. So Aidan, thank you. And on the assessment framework, this is a very important topic, because this is all about how we make sure we are really clear about how we assess providers, how we make sure that we offer a level of focus based on the type of provider, how we make sure we're clear what good looks like, how we follow up essentially all of the recommendations, Mike, that you made in your previous work, and that we take the recommendations from that report and indeed feed in the recommendations from other external reports that we've had to make sure our assessment framework is fit for purpose. And a lot of work's been going on there with provider roadshows, testing, engagement, and making sure that we do get that right. And then I've mentioned CQC way and our values, behaviours, shared purpose underpinning all of that. And I think I'm going to hand now, if I may, Mike, to Esther to talk us through what is really key in terms of all of that, which is the IT, digital, data, the regulatory platform, all of the issues highlighted in the independent review that we considered at the last board meeting, which we have put all of it in the public domain. It is on the website for anyone who is interested in that. We felt it was important that we share an update on our plans to address those challenges in the public board. So thank you.
Thank you, Julian. Over to you, Esther.
Thanks, Julian. Thanks, Chair. So just by way of context to add to Julian's comments, for new colleagues sat around the table and those listening, at our March board meeting, we considered the independent review of our IT. There were 23 recommendations that were made. It is a sobering read for those of you that have read it, and we considered that at length at our last board meeting. And we committed to bring back to our next board meeting our action plan or our response to those 23 recommendations. So the paper that we are looking at today, which will be uploaded into our public board paper pack by the end of the day covers off our response to the 23 recommendations that were made as part of that independent review, and also outlines a response and a plan to deliver the 2 foundational improvements that Julian mentioned, one in particular around our digital systems and the second in respect of our data. I'm not intending to outline the response to all 23 recommendations today, but those will be in the papers that you'll see on our website. But I would like to highlight some key points that are really important for our colleagues that have experienced such difficulty and challenges with our IT platforms. So that's colleagues both internally, who I know will be listening, and also our provider colleagues and our partners who use our systems and also access our data, who have also experienced challenges. So the key points I'd like to outline are, firstly, we anticipate it will take us around 2 years to really stabilise our digital platforms. So we are really starting again from scratch in terms of the functionality that our digital platforms use to help us do our duties and our regulatory duty. So although we think it will take us that period of time, the roadmap that you will see in the papers is deliberately phased. It's a deliberately iterative roadmap to deliver improvements throughout that time. So colleagues and partners will see improvements throughout the period ahead of us, and it won't be all at once at the end of that period of time. The roadmap sets out a sequencing which has been carefully considered and also socialised throughout the organisation and with key partners. The premise of the roadmap is that it tackles the most important and risky pieces first, the ones that are causing us the most challenges. So you won't be surprised to see that our assessment functionality is planned to be redesigned and rebuilt first. And this is in recognition of the number of interim workarounds that we are currently working with to help us still complete our assessment process and publish our reports to support improvement in our sector. So that is a particular challenge that we are dealing with, and therefore it is the first thing that we are intending to tackle. And then the roadmap sequencing that you will see goes on to our registration functionality and enforcement, and then our other functionality or core functions as an organisation. So although the roadmap is staged, we are absolutely, well, it's critical to understand the interrelationship between those core functions. So that activity will not be siloed. There is a really important piece of work that will be ongoing to make sure that we continue to align and understand the relationships between our functions to get this right. The next piece I just wanted to mention was the recommendations that were picked up or cited in our review around a data-led culture. And again, our platforms, our IT platforms, it's very clear that they were not designed with a data-first approach. So we are struggling to report, and there is a lot of manual input and validation required for our reporting at the moment, and we are missing multiple opportunities to share and collectively use our data to drive improvement in health and care. So there is a period of stabilisation needed, and that is reflected in our roadmap to ensure that we have our internal processes and architecture set up in a way that really supports that. But we are also starting a conversation with our new board here today, and also with our providers and other external stakeholders and the organisation around how we can better use our data to drive that improvement. And that work will start from an engagement perspective over the next couple of months, with a view to publishing our intentions towards the end of the year. So as I said, the roadmap has been socialised throughout the organisation and with key stakeholders. Can I say thank you to all who responded to that roadmap and provided us feedback. The main points around feedback were around desire to see a more granular and detailed plan. So you will note it is very high level at the moment. Colleagues in particular would like to understand where their challenges they are facing in their day-to-day work will be resolved. The The other key piece of feedback was around how can we make sure that we align our activities both with other change programmes or the other foundational improvements that we are working on, as well as the interrelationship between the functions that we are looking at. So again, we are responding to that feedback. We will continue an ongoing conversation with our colleagues around that, because it is so important that the feedback that we've received is responded to and listened to, because we know last time that didn't happen. One of the key responses to recommendations made by Peter are going to be picked up in our co-design approach. And so you will note from the papers and from the independent IT review that there were colleagues and stakeholders who were missed or not listened to as part of that process. And that has resulted in systems that are not fit for purpose, and our colleagues are finding it incredibly challenging to use. And there has been a significant impact on health and well-being, both from a physical and mental well-being perspective in some of our colleagues and teams. And so our co-design approach is being set up with making sure that we include all of our colleagues and stakeholders that need to be in there. And a key response to one of the recommendations is us making sure that our staff reference group, Diane, you're here today, and thank you for your input into that so far, but our staff reference group, who are made up of chairs of our staff networks and our trade unions, who are also on the call today, thank you, are part of that reference group and can help us and support us to make sure that we do not miss any critical colleagues or functionality that we need to embed, and make sure that we get that right. And so that will be a really key relationship going forwards, and that is currently being set up. So as I talked about earlier, our data strategy piece, we need to absolutely make sure that this time round we adopt a data first approach, and that will be part of our co-design process. In fact, one of the first pieces of our co-design process. So we make sure we understand the interrelationship between our role and our functions in the CQC, and also get this right from a data perspective. So one of the other key points I'd like to make is it feels there was a real disconnect last time with what our digital programme outcomes were and the needs and requirements of our operational colleagues on the ground. And so again, that co-design approach is fundamentally going to be kind of carried out with a principle around joint decision making. So we need to make sure this is not a digitally led programme. It has to be done in conjunction with our colleagues and our stakeholders to make sure we get that right, and that will all be part of the co-design process going forward. And that ongoing dialogue is so important, and one that we will continue to have going forwards. And I hope the colleagues who are listening to this call have been watching with interest our communication around this, and that will absolutely continue. So I'd just like to highlight a couple of risks, and then very happy, Chair, to take questions if there are any. So there is a level of risk around our plan, and I don't think that will come as a surprise. One of the things that I think I'd like to draw out is our ability as an organisation to adopt this level of change, and we are changing a lot at once, and that is why our roadmap is deliberately staged, and that is why our co-design process is baked from a principal perspective in joint decision making, to make sure we can be nimble, respond to the challenges we have, continue to complete our assessment trajectory, and continue to meet our performance around our assessments, as well as our other core functions, whilst we rebuild and redesign our IT platforms. But the challenge ahead is large, but we have, I believe, the right things in place to make that happen. But there is obviously some risk to that, and I think we would do well to acknowledge that. I think that's all I was going to say, Chair and Julian. I'm very happy to take questions.
Esther, thank you very much indeed for that. We'll open it up now to other members of the board. Any questions or comments? I think one thing that came through of our discussion yesterday was the magnitude of the change that's needed, and with that the level of risk that there is, and the fact that we can't immediately say we can switch it on now, it's all going to work immediately, and so we can get back to normal. This is going to be quite a big mountain to climb. Alex.
Thanks, Mike. Thanks for that update, really helpful. We obviously did discuss this yesterday, but I just wondered in the public board if you just wanted to say a little bit about the work going for the information governance concerns and how we're going to fix that.
Yeah, thanks, Alex. So we have a level of risk we're carrying around our information governance kind of activity, and we have put in place some safeguards from an immediate perspective to reduce our risk in that respect. I think it's fair to say our programme of improvement around information governance follows a similar trajectory to our rebuild process to make sure that we undertake our rebuild with privacy by design in place. And so thank you, Alex. That is absolutely worth acknowledging. There is a planned programme of work in place to address that, and obviously that's overseen by our audit committee internally.
Yes, Diane, you next.
Thank you. Esther, I just wanted to thank you for the engagement that you've had with all of the equality networks. We're really appreciative of that. There's just a couple of questions that I've got based on feedback from some of our members. You used the term iterative, and that is a term that is quite loaded within staff at the moment because that was what was promised before. And so I think we would like to understand exactly what that means. Does it mean that we are honestly going to pull back if changes don't work? That was what was promised before, and they just went hell for leather in terms of we want to get rid of CRM, so we're going to do it anyway. So that's one thing. We also welcomed your talk of using much more structured project management because that clearly wasn't used before. So yes, this is a very long-term plan, but what kind of push-pull is there in that to be open to this actually might take longer than 2 years? So where is the push-pull in that? And another question, sorry, loads of notes at the moment, is so this was, the changes were all aligned around the strategy, and so we sort of have some questions about that strategy is coming to an end now. So is that going to continue, and are our aims going to be the same? So for example, there were things like, as you've said, inspections were going to be data-led, reports were going to be much shorter and more concise. Are those things that we are still aiming for? Is the strategy still standing in that regard? And just finally, I wanted to thank you and Anthony Stape for responding where people are saying that they're having concerns with the technology. However, we have got members of DEN who have said that they effectively still cannot do their jobs and potentially have to be redeployed, which they're finding very, very stressful because the current system doesn't work with the assistive tech that they've got.
Thank you. Thanks, Diane. Really helpful comments and questions. I've made some notes. I'll try and cover them all, but please keep me straight if I forget something. So, iterative, the word iterative, thank you for that. So that's really helpful. Obviously, I wasn't here last time, so the loadedness of that word I haven't understood, but so thank you. That's really helpful feedback. Maybe I can explain what I mean by that, because I think that might help. So, and I outlined yesterday, my priority is delivering a safe and stable IT platform of which we can build on, and that is key. So my understanding last time, and again I think where we've ended up, is there was a lot of complexity built into the systems, and the scope changed and crept throughout the design and rebuild process. And so we have a set of systems that are in some ways really complex and have really complex business rules that are kind of hardwired into them that actually are not what we need. And so when I talk about iterative, it's around delivering a safe platform that we can then build on to make sure that we can cope with the change. So there will always be change, there will always be continuous improvement, we will always tweak how we do things, and that's, I guess, part of life. So my priority is to give us a stable foundation on which to build on and make sure we can cope with the changes like the ones you mentioned about, you know, what the size of our reports or how we do things, you know, might tweak and change, and that's part of improvement. But my priority is to give us a foundation that can manage that, and we can do those things in a really planned way. So in line with the principle of keep it simple, which was recommended in our independent IT review, what we're likely to see is simple functionality that we can then build on, and we can then tweak in a very planned and structured way. And that's what I mean by iterative. So what we will not end up with, or very much doubt it, is, for example, an assessment functionality that does everything that we think we need it to do for the next 5 years. That's just not realistic. What we will start with is a simple application, a simple system that works, and then we can use that on which to build changes and improvement in. So I hope that answers kind of that piece of the question. And if there's a better word I can use, I'm very happy to use that, Diane. You asked about rolling back, and a really good question. In essence, we have rolled back, haven't we, to some of our legacy systems, and that's causing us some risk that we're carrying, but we have rolled back. And again, just to wrap this up with your governance question as well, where we need to get to, and this is being planned, is around some really strong, secure gateways, an agreement as to whether what we build is fit for purpose and used, and then there will be a joint decision around that going live. So that I feel really strongly, and this goes back to my comment around joint decision making, feel really strongly that that decision making has to happen with all those colleagues and partners that are using that piece of functionality. And so what we will not do is end up in a situation where our digital colleagues say that something's ready to go, but our operational colleagues or other stakeholders are not happy with that. So if we get to that point, we will stop, and that's really important. We will pause, because otherwise the negative impact is just too great. So that will be wrapped up in joint decision making. From a contingency perspective, we absolutely, in line with best practice, you enable the functionality to roll back, and we can plan that as part of the co-design process, Diane. That's part of that planning and that joint decision making. I think I've covered your questions, but do let me know if I haven't.
Julian, you want to come in?
I just wanted to answer Diane's question about strategy.
Yep.
And I mean, really good question, Diane. I'm sure you'd agree it was the execution of the previous strategy got us into the deep trouble that we're in. So what we, as you know, what we are focusing on, based on both the external reviews and reports, but also importantly the feedback from all of our staff following the question I posed to you all on joining the organisation about priorities, hence the kind of 4 immediate priorities and the 5 foundational improvements. In terms of a broader long-term strategy, I think given we've got a new board, we have got some time together to think about that. We'd want to engage with all of you as well. So I think right now we're clear about the focus on the action we need to take rather than elaborate strategies, and the focus on the things that Esther's described. So I think that there'll be an opportunity to think and shape, but I'm sure as again you probably acknowledged, the culture of any organisation has greater impact, influence than a strategy. So we're really focused on getting that right, and then in time this board will have an opportunity with the whole organisation, because we are part of one team, to shape that looking ahead.
Back to you, Esther.
Yeah, Diane, I forgot to answer your question around our colleagues from disability and enablement network. So I do know that we have challenges in this area, and we know that our current systems don't always work with the assistive technology that some of our colleagues are using. I'm very happy to look at this on a case-by-case basis. The real challenge we have is the question of how much time, energy do we invest in resolving our current systems versus rebuilding and redesigning new systems that will support all of our colleagues. And so there is a real balance to be had there. So, and previously, I think it was at the last board meeting, you know, I'm absolutely committed to making any improvements that we can make now that are sensible to make. But I do absolutely acknowledge that we can't do everything now, and that will mean that some colleagues are continuing to work in a really challenging environment. You know, there is a real acknowledgement there, but, you know, my commitment is I will do what I can now, but there may be some things I just won't be able to do because we do need to attend to fixing everything rather than trying to kind of plough our energies into the here and now. But absolute empathy and kind of an understanding of our colleagues in that situation. And I know how difficult it is on the ground. Having seen, you know, how some of our systems work, it is very challenging. So absolute acknowledgement around that.
David, can I bring you in?
Thanks very much. I intend to try and keep this with the narrative that's developing on this. Esther, your paper is very comprehensive. It's straightforward, but it covers an awful lot. It does raise with me a couple of points which I hope are helpful. The first thing is about pinch points. As you go through with several work streams, there are always points at which there are interactions between those, etc. And I wondered, I'll go through my several questions, if I may first, whether there are any points that we ought to be aware of now from the work that you've done that you think are going to be critical and tight that we need to be aware of as a board. My second point really was when I looked at it and I looked at the resources that you've got, I was concerned about whether you had sufficient resources. And the resources I'm talking about are obviously financial resources, but also about the support structure that you need for this very clearly laid out program of work that you're doing. And if you could just update us on where you might be on that, because it's important, I think, that you feel that you've got the support structure and the capability that you need to support you achieve these things. And finally, and you would expect me to say this, of course, as one is developing something as different as the program that you're developing, what about things that we're doing now that we perhaps no longer will need to do in the future? And I would like you to consider that, because that would be something that would not only streamline our operations, but it would focus the resources that we've got on that. So those are the points I wanted to raise with you, if I may.
Back to you.
Thank you. Thanks, David. Again, really helpful questions. So from a pinch point perspective, there's a number that come immediately to mind. The first I call out in my narrative of the paper, and I think this again is a cause of concern or anxiety across the organisation, and that is how can we build a new assessment functionality application whilst we are intending to go out to formal consultation. And I think that is one particular anxiety for the organisation, and there is a concern that we will start rolling out new functionality in November and then get to early next year and realise that we need to completely change or radically change the way that we do that, and therefore go through a second rebuild and redesign process. So my response to that is, again, just referring back to my previous comments around keeping things simple, but also creating a stable foundation on which to build. At the moment, we do not have a stable foundation on which to build in any changes to our assessment functionality. We are using complex interim workarounds that our colleagues are using a number of different systems to complete assessments. And so if we were to try and introduce changes to that process now, we would find that very, very difficult. So we need to introduce a stable foundation for our assessments. And as much as possible, what we will do is future-proof the build of that to take into account what might happen as part of the outcome of the consultation. And that is entirely possible and doable. There may well be some tweaks needed post-consultation, but my desire is to make those as minimal as possible. And I think with some good planning that is already underway, we can make that happen. So that's one pinch point, David. The second one is, and they're kind of related, it again refers to one of the recommendations made in the independent IT review, which is around a better understanding of our business processes. And so what we have ended up with this time is a system which we call our regulatory platform, which doesn't service the needs of all of our core business areas as a CQC. So a lot of areas were de-scoped, and there are a number of business functions that we have that are not part of our regulatory platform and are still using legacy systems. So, for example, our oral health team and other kind of smaller core kind of central functions that are not necessarily part of our standard approach to assessment and regulation and enforcement. They are not part of our regulatory platform, and we don't well understand, or we don't well have it documented, how all of our functions interrelate. So there is a real need to do some preparatory work around that, and that is starting as we speak. But that piece around how we build a system or a number of systems that interrelate to effectively enable us to do our run our services and discharge our regulatory duties is quite a challenge, and there's a piece of preparatory work there needed, David. So that's probably my second pinch point I would just call out. From a resource perspective, you're absolutely right. We have a really great set of colleagues that I work with in our kind of digital technology and data and insight functions, but we don't have all the capability or capacity that we need to do our redesign and rebuild. There is a piece of setup work that we need some support with, and there is a mechanism already in place that we have discussed as an executive team to help us get the immediate resourcing that we need to help us do our enablement kind of preparatory work phase that we are in. And then any additional support, of which there will be a need for, David, will be part of a business case that this board will review and approve over the coming couple of months, which is an important step to release the resources that we need to make this important work happen. And then finally, you asked me what will stop. I can think of a number of things off the top of my head. So again, as I mentioned earlier, we have challenges with our reporting and our data. We have a lot of manual validation work that we do at the moment. We have a lot of QA and kind of data governance in place that we have had to put in place to keep us safe. Those are activities that I would anticipate will stop or taper off over the period of time that we do our rebuild and as our systems get more mature. And again, this is an opportunity, and again, that's why the co-design process is so important. This is an opportunity to streamline our processes. And so I would really value in that co-design approach that we will be talking to colleagues about over the coming weeks, conversations about how things should be done from an efficient and effective process perspective, and not just rebuild processes that we currently do because we've already done it in that way. So I think there's a real opportunity as part of this to make sure that we're more efficient and more effective in the way that we work. And then just finally, I think we acknowledged yesterday that we can't do everything at once as an organisation. We've got a lot of work on, and so there will no doubt be things that we will decide to pause as part of prioritising our work and our focus and our resources over the coming year or so.
Thanks very much, Esther.
Thank you, Esther, for all of those answers. Any other questions to Esther, or indeed questions on the priorities programme as a whole, because we got heavily into the IT, so any questions to Julian on the priorities programme? Can't see any, so I think that means we can go into the draft business plan.
Thank you very much, Mike. So what you have before you is essentially the metrics or the how we measure our progress against the key priorities that we've just discussed. We also have a suite of other metrics that cover other areas of activity that CQC undergoes. Now, this is important in the sense that we need to, I think, visibly, publicly demonstrate how we are improving, how we are progressing, and be able to measure that and demonstrate that. I've already gone through the progress we're making on those 4 priorities, but I think there's a level of detail that sits below those about the specific areas that we are measuring, and both Suzanne, Esther, and indeed the whole exec team has worked hard to make sure that we can be confident in how we can make sure we're measuring this effectively, we've got the right data flows, and all this comes into a balanced scorecard that we can use both for the board moving forwards to give an update on performance, and also in discussion with our sponsor team at the Department of Health and Social Care, because of course they're very interested in seeing demonstrable progress against these areas. The other thing I'd say is that we have done a lot of work with wider teams in the organisation to make sure that we've got the ability to gather the data, report on the data. I would also emphasise the fact that in conversation with trade union colleagues, networks, and indeed all staff, the importance of making sure that we see these in the sense of empowering teams, team-based approaches, a sense of how we do this with the right culture and support around that. We are not about a kind of blunt performance management approach. This is very much being done with the focus on empowering teams to build confidence, to deliver, and to then see the visible progress that we are able to make. So what I would appreciate, actually, it does say on the paper the board are asked to discuss and note. At this point, I would appreciate approval of these metrics with the proviso that, of course, we may need to tweak, change, add as we move forward, particularly in ongoing discussion with colleagues at the department where there are particular issues that they might be interested in. But having already discussed these metrics and built them into a balanced scorecard, I think we're in a better position in terms of being absolutely clear what we're aiming to achieve. A lot of the feedback we had from external colleagues in terms of organisations that represent providers that we regulate have said consistently, we would like to see how you are holding yourselves to account against deliverables. We would like to see measurable progress, particularly on things like inspections, registration, some of the important work on IT and digital, the ease of submitting documents and so on, the speed at which we're able to respond to information of concern. And actually, we've raised the bar on some of our ambition in these metrics. We've set tougher targets for ourselves to achieve. So this is by no means an easy ride. This is going to be require a lot of focus and a lot of work, but I do believe it's the right approach in terms of speaking to the key priorities, foundational improvements, as well as some of the other key areas that we where we have activity. So that's the context for these. I do appreciate there's quite a lot of them, but this is an attempt to create a balanced scorecard across the range of activities of CQC. And certainly I think that as a board, we'd want to make sure that we are, you as a board are holding us as the exec team to account for delivery of this, and also that we're supporting our valued colleagues to see progress and improvement and use that to further build momentum and positive progress over the coming months. Thank you.
Thank you, Julian. and people will have observed that these cover a wide range of different areas, so people may wish to comment, you know, it's not just the total volume of assessments, but it's the assessments in each area, and then the registration issues, etc., and information concern, etc., etc. So I'm going to open this up for discussion. Melanie.
So it's really important to see this, and I'm really pleased to see that the core business is represented. So I know there's many measures, but I think that's necessary given the breadth of the core duties that we have. I want to relate this back to the previous conversation. So what's our level of confidence that we've got the data maturity to be able to meaningfully understand this and report on it?
That sounds it might come back to you, Esther, again.
Thank you. So I think there's probably a joint response between Suzanne and I. So we there are the metrics in here are the ones that we can measure, and we've done that work. There are other metrics that we cannot, but we have done that validation work between my team and Suzanne's performance team. But I'll hand to Suzanne if that's okay, Chair, to see if Suzanne wants to add anything.
Yes, it was just to say that when we developed the measures and targets, they were reviewed and developed. We looked at the context of existing report resource priorities and the system limitations, data quality and missing data points. So this is actually what we can measure.
So this is doable. That's somebody else. Yes, Chris.
Yeah, thanks for sight of these. I think my comments would be really around some of these have got target dates in September 26, and I think the comment, just to sort of reaffirm what others had said, is being clear on the kind of milestones we want to get to ahead of then to show enough momentum and progress, but without rushing to do something where we haven't got the foundations right. I think there's an interplay clearly with the work Esther's talked about, but also for these to be delivered, we need to create the conditions with which colleagues can succeed. And it's clear that there's still some foundational elements where that's not the case. So we'll need to review those and understand where they happen, and I guess be really open and transparent where we come across roadblocks, and be clear to the teams that are here, but also partners, providers, etc., about why that's happened and what the alternative plan is. Because I think it's important that we do that rather than simply chase a target. It's important to show progress, but we need to be doing, that number of assessments, but they need to be quality assessments. So we need to look at the numbers and the quality of what we're doing. Otherwise, that will impact on credibility. So something that just talks about as we go along where we expect to be, and if we haven't, why, what we're doing about it, and being really clear around what the alternative plan is.
Thanks, Chris. Yes, just to say on the number of assessments, we've actually got a glide path and a trajectory month by month of incremental increases to take into account previous productivity, and also take on board new starters, new capacity, etc. So we can do that incremental growth as we go along. So you'll see that in the more detailed reports. You'll be able to see that.
Alex and then Diane.
Yeah, thank you for these. Look really good, very comprehensive, a lot to measure, as you say, and very happy to approve if others are. It would be quite helpful, if this isn't a lot of work, for us as board members to see where we are on the baseline, just to see how you've set it. So, just to pick one at random, percent of providers who have the positive sentiment about the new portal at 68%. I'm sure it's not higher than 68% now, but for us to know, why we've set this and whether there's stretch goals or not, which I'm sure they are very stretching. If it's not a lot of work, if you could just circulate out of session where we are now, I think it helps us assess whether we've set our ambitions too high, too low, or right. Thank you.
Nodding about that. Yes, Diane.
So yeah, I just wanted to say that the Equality Networks are really grateful that you've mentioned culture when you spoke about this. Some concerns that have been raised to us around this are the issue of recruitment, the fact that it is still not where it should be, it is still far too slow, and so there is the potential risk that while we know that we've got to recruit people, are we actually going to be able to do that effectively and at the rate that we need and at the speed that we need? also in terms of recruitment, there's the induction and whether that is going to get people up to speed quickly enough and whether that has been taken into consideration, because even though you do induction and it takes a certain amount of weeks, in order to be a skilled inspector, you know, it's more than a few weeks to do that. And the other thing about culture that you mentioned, I think the concern that was expressed and what came to mind this morning was this idea of it's not the tools that are the problem, it's the intention behind them. And so we've got the tool of the target at the moment, but sometimes there is an intention behind it of competitiveness where certain individuals might want to use that target or exceed that target to almost prove themselves, and that can be detrimental to staff in some ways. I'm not pointing the finger at anybody, I'm just saying that that is a potential element that we need to think about.
Esther, if you want to come back.
Thanks, Chair, and just responding to the point around the metric around the portal. So apologies because I think I missed this, but there are actually two metrics that we agreed. One was around our portal and one was around our website use, and they are importantly different. And our expectation is that we wouldn't necessarily see an improvement on the portal one over this coming year because of our rebuild work. So if I may, Chair, there is just one adjustment to make to this paper, and I apologise because I didn't see that it hadn't been made prior to publication.
Thank you. Any other points on this? Suzanne, did you want to come in?
Yes, it was just to say when we did the targets, particularly on the number of assessments, we've taken on board the current headcount and who we've got, and we've not kind of based this on we've based it on the current we've based it on the current headcount, and so we're taking that into account through the numbers.
David.
Thank you very much. I think, Chair, you're going to be asking, certainly as Julian did, for approval of the draft business plan, which I, for one, would be very happy to approve. But next week we expect, who knows, to see the NHS 10-year plan and the DASH review come out. And if we do approve this, Julian, I think it might be very helpful certainly for me, perhaps for other board members, if when you've had time to digest those two things, if there are any significant changes to what we've approved today, just as a headline, you know, to know that we would be apprised of that, I think that would be very helpful, if I could suggest it.
Yes, David, very happy to do that. And I think just as a general point, I think there's a lot of change and moving parts at the moment. As you say, we need to be agile in the way we can respond to that. And I think the point you made, Alex, about just understanding where we start from is a good one. So I think what will be helpful is approval for what we've got, but with the acknowledgement that we may need to adjust, change, and also add some follow-up information to make sure that we keep this fit for purpose in terms of what we're measuring and reporting on based on the environment that we're regulating. I'm sure, David, that there'll be some many things for us to consider as CQC in the context of 10-year plan. We do have some time, Mike, don't we, as a board to come together in July to have a good session to think through some of that. So I think, David, it's a well-made point, but I think we've identified the need for us to come together and think about how we make sure we're building in the important ambitions of that plan into our work looking forward.
And if I may say, and the guidance, the streams of guidance that are likely to follow that subsequent, which will be, you know, the department, the government's view about where the priorities lie in that and time sets again. Same.
Chris, I think you want to come in.
Yeah, I was just going to come back to acknowledge Diane's points about recruitment and induction. Just Jackie's not able to be with us, but just speaking on her behalf, I know a lot of people have talked to me about recruitment and induction. I spent a morning with the recruitment team last week in Newcastle, so I can see all of the challenges they have and colleagues have. So I know one thing we're trying to do is look at how we create capacity and how to help operational colleagues, because recruitment is a burden in itself, and just how we create some capacity that side, and then how we can help with the process. And I know one thing we need to look at is just how we do our workforce planning, because I think there's challenges in terms of how and when we recruit the right people, which the recruitment team were talking to me about. Induction as well is something that we're looking at, just to look at how we can make that process more efficient and effective. So I know Jackie was on with that. So it was just that knowledge. We're fully aware of both of those and on with them.
Any other questions at this stage? If not, I think where we've got to is that we're now being asked to approve the draft business plan subject to any adjustments that may be necessary, particularly in the light of the 10-year plan, and also to add in that we'll get some baseline figures so that people can see how far off those targets, if you like, we are. Is that acceptable to people? I see a lot of nods around the table, so I shall take that as acceptance. Thank you very much. That's an important step. In which case, Julian, it's back to you to report from the executive team, but you can bring in others as you wish.
Thank you very much, Mike. So you've got the report on the work that we've been doing as an executive team in terms of a lot of engagement, actually, and I wonder, Chris, you might want to say a little bit about that, because we've had, over the last several weeks, a lot of interaction with providers, with different sectors and key stakeholders. Most recently, I think we had an important part to play in the NHS Confederation conference, and thank you to colleagues who ran the stand at the Confed, and they reported a lot of positive interest in the work that we are doing, and a lot of actually people in sectors, in providers keen to help and support us in our work. I think the range and scope of that engagement demonstrates, I think, the importance of us getting out there and demonstrating how we're changing and what we're doing to make sure we take seriously the feedback that we've had. And then I think maybe, Aaron, you might want to say a little bit about the mental health bill, because obviously a lot of work on that. That's a very important part of our current work, and since you've joined us, I know that's been an important part of your focus. And then I think the rest of the report really just highlights what we've already discussed around the progress we're making on our key priorities, our foundational improvements, and also how we're better gathering insight from people that use services to get good qualitative and quantitative feedback. And hopefully, particularly with new colleagues around the board table, we can do even more of that in terms of gathering that insight and then feeding that back. Our state of care report relies on that quality of feedback that we gather, which is going to be so important. So maybe starting with you, Chris, then maybe Aaron, and indeed any other colleagues that want to sort of comment on the work that we've been doing over the last few weeks.
Thanks, Julian. I wonder if I could just acknowledge that the thanks I have for providers, people who use services, and colleagues who've been involved in the co-production events that have taken place so far. We have many more planned. In fact, we have one going on today in Leicester, and I'm joining a second event in Leicester tomorrow. The 6 key strands to our work at the moment. As Esther said, the importance of co-design, co-development is crucial if we are to be successful. It literally plays to the point we talked about earlier about making sure that we're bringing people with us who will have to operate the systems, use the systems, and get the benefit of the systems. And I do think in this co-design and co-development work, bringing colleagues, providers and people who use services together in the same place is actually very useful, culturally useful, I think, to make sure that we're all in the same place doing the right thing. Alongside that co-design, co-development piece, the importance, and it mentions in the report about regular communication to colleagues, to providers, using both internal and external channels, to people who use services, so that everybody understands where we are. And I think we're trying to do a little bit more thinking about informational content as well, that tries to show the links between different areas of work, so you get to see not just things in strands, not just conversation about the assessment framework, but what's the relationship between the assessment framework and the work we'll do on the redesign of our system. So try to show how that works sort of end to end. There has been a number, and importantly, good conversations with strategic partners in this space as well, so we can think about not only the day-to-day interactions, but also how we link strategically to other organisations involved in our work. An important part of this will be about making visible the people that are doing the work. I think one of the things, learning from the last transformation, is making visible the people who are actually doing the work, who are actually involved in that engagement, and making sure that they're visible to colleagues, visible to providers, visible to people who use services, so that we can be really clear that and provide the right feedback to people, so we can make the right informed decisions. And all of this, of course, is then to help us do the things that you talked about, Julie, in terms of state of care. So all of this contributes to our ability to have an informed view of the health and care system. So a lot of the work that we do isn't just about individual inspections or individual areas, it's about what we know as an organisation in the systems that we regulate. And I think as we come through that co-production work, making sure we're able to not just deliver on individual inspections, but deliver content that's meaningful for our future views on how sectors are performing will be critical.
Thank you, Chris. Should we move straight to you, Aaron?
Thanks, Chair. It may be helpful for me to outline a couple of key priorities from my perspective for the mental health sector. We obviously talked about the 4 immediate priorities and the 5 foundational improvements, which are cross-organisation. But since I've started over the last 6 weeks, through speaking to patients, through speaking to providers, and from speaking to other stakeholders, 2 key areas which they've really emphasised to me that they were very keen that we prioritise and that I'm keen to take forward. One is around driving improvements around the pathways that people take when they are entering and leaving mental health services. What providers and patients are both saying to me is that actually that's one of the areas that they think worries them the most, and actually where they think that there's most opportunity. So in that space between when someone's been referred from general practice to mental health services, negotiating the pathways within mental health services, and once they've been discharged, how can they get back? How can carers identify concerns? So one of the things that I've been working on with the team is around our assessment framework, and how do we make sure that it has the right questions in it so that we're identifying those gaps and working as a regulator to help close them. So that's one key priority area. The second key priority area is around the mental health bill. The work that our Mental Health Act reviewers do, and our Mental Health Act operations generally in the CQC, is really vital work to safeguard people's rights and promote human rights of those people, and also to address inequalities. With the Mental Health Bill that's just completed its committee stage in Parliament, there are some brilliant safeguards there and some great innovations that could really address some inequalities aspects and improve the rights of patients. But it's going to be vitally important that they are properly implemented, and we have a key role in monitoring that implementation. So I'm very keen to strengthen the work that our Mental Health Act operations team do, working alongside our inspectors to actually make sure that those ideas, as they come through from the bill, are properly implemented, and that we're asking providers how they are delivering the expectations from the new Act, and identifying areas of best practice and looking at compliance with the Mental Health Act generally. So that's a kind of key focus area for me.
Thank you very much, Aaron. I think eloquently demonstrating why we have needed a Chief Inspector of Mental Health, so that's great that you're with us. But Chris, you've got a question.
Yeah, just to echo that priority from Aaron, I think it's important. It's a good example, isn't it, of one of those areas which will need cross-working across chief inspectors, particularly, Mental Health Act. I'm thinking around, I think, new commissioning that will need to take place, local authorities around learning disability and autism, which will be an impact of the Act, which I think will be welcome, but will need thoughtfulness from both NHS and local authority commissioners, impacts then on the provider market and what needs to be delivered, and of course associated impacts for AMPs and so forth. So I think illustrative of the need to think through how sectors work together, particularly on big issues like this, which have an impact across the system.
You want to come in, Aidan?
Yes, happy to comment. Thank you, Mike. So I'm now almost exactly 4 months into a 6-month period, and Julian, you'll remember we discussed where we might support. So supporting the incoming and appointment chief inspectors, tick. So I will overlap with the new Chief Inspector of Primary Care briefly and seamlessly transition with the Secondary Care Chief Inspector, and you'll not be surprised that we're already having conversations about transitioning that, which is really important. Just to echo what Julian was saying, the stuck assessments for a starter have been a real concern. Some of these have been quite aged, so there's been a lot of engagement with chief executives of organisations around that, so I'm really pleased that we've made such good progress with that. I think that's really important for providers. Publishing reports that are quite aged has been problematic, and our ability to re-inspect those organisations and creating the capacity for that has been really important. I think the work on information of concern has been critical, and getting those processes right and being more timely with that and knowing what the risk out there is really important, as it is with notifications. So I'm pleased to see we've made good progress on that. Lots more to do on the assessment framework, but we've started that process, and we had another important session on that yesterday, and you won't be surprised that I've taken a very big interest in the safe domain particularly, and trying to feed into that. Supporting MNSI, and you rightly point out the ongoing concerns about the maternity system, and making sure our investigations around that are timely and important. I would say, I think, in sport and maternity, that one of the most satisfying things I've done here is publishing the report on maternity in East Kent and seeing the progress they've made following concerns there. And I'd just like to say how pleased I am to see progress in that area. I think that's an important reflection. Just making sure that our reports are going out in a much clearer way, saying why are we there, what are we seeing, and making clear why we're rating as we're rating. So I think we've seen some really good progress, and I'm pleased that we've been able to achieve that.
Thank you very much indeed, Aidan, and thank you for what you have done over the last few months and are going to do until you go. Any other points from the executive team that people want to say? If not, we can move on to the dementia strategy. Sorry, there is one. Sorry.
Just a really quick reflection. I mean, I absolutely think at the moment the evidence of impact has to be on delivering the core functions now. But it's really good to see there's some suggestions of where we may move to in the future, thinking about broader impacts, so the cross-sector work and a focus on mental health, and then the next item a focus on dementia, because that's really the space we want to get into, isn't it, into the coming years. It's about the impact on people's lives and their outcomes, actually. So it's just to say that I welcome that sort of sprinkling of suggestions about where we're headed as well, but recognising there's a job about safety now.
Thanks, Melanie. Any other points around the table? If not, we'll bring in our presenters for the next session, Stephen Kelly and Joe Wallace, and they can then introduce themselves. I think we'll have about a 1-minute break while they come in. Welcome to you both. maybe you would like to just introduce yourselves and what your roles are, but this is a really important item we're coming on to, which is dementia. Interestingly, and just in the last session, we were also discussing how important it is going to be to work across the areas that the 4 chief inspectors cover. I think that's probably shown by dementia as much as it is by any area. Stefan, do you want to go first and then hand over?
Thank you. Good morning, colleagues. I'm Stefan Kelly. I'm Deputy Director of Adult Social Care.
Good morning, colleagues. I am Jo Wallace and I'm also Deputy Director of Adult Social Care.
Okay, over to the two of you, and when you finish talking, it's best to turn your red light back off again. That helps the camera, I'm told.
Okay. So good morning, colleagues. Thank you so much for having us here. So we are here to talk to you about the work we've been doing on the dementia strategy, to give you an update. And this item really is about improving the experience of people living with dementia in all settings, and our regulation of that of those settings as well. As part of that work, on the 20th of May, we published our first independent voice piece as part of the dementia strategy, and that was about the experience of people living with dementia, their family and carers across sectors. That report really highlights the continued inequalities, barriers, and the variation in care that people continue to face across the sectors. So it's a really important topic, isn't it, for all of us? But who we have voiced in the report, the experiences of our people who have used services in GP practices in the context of access in hospitals and in adult social care. And the voice of people do really highlight where things have gone well, but they also highlight where there's been real issues. So, for example, someone saying about access, that they have felt really left alone, that they hadn't seen a doctor or nurse in over a year, and then someone else saying that their GP had been an absolutely fantastic advocate for them to get their diagnosis of early onset dementia. A member of the family saying that their mother in hospital had been under 24-hour observation with no human interaction, and then saying that when they visited mum in the care home following that, mum was sitting in the lounge singing Christmas carols while the carer was giving her a head massage and saying, who wouldn't thrive in an environment like this? There are so many different experiences in that report, and I think one that really summarizes what good can look like when there is good collaboration is someone saying the team worked together so well so that his wife could be his wife again, and his daughters could be his daughters again, and not just his carers. There are many more voices, but I think this topic is so important for all of us, isn't it? I mean, it's now more likely than not that people will either be living with dementia or be a carer. The number of people living with dementia is set to increase to 1.2 million by 2040, and the cost of dementia care is set to increase from 42 billion last year to 90 billion in 2040. And that's just the financial cost. What of the human cost? The fact that dementia continues to be the leading cause of death in England. So I'm really proud of that report, and I'm really proud and pleased with the support it has had and the support this work has been given by external partners. And that included when we attended a parliamentary event last autumn, which was joined by around 150 MPs. But the independent voice piece itself had great support from our external partners, including from Care England. The report is a call to action for others, but importantly to ourselves at CQC. So we must press on. So the question is, what's next for this work? And that's developing statutory guidance. That's really the centerpiece of the dementia strategy. It will be a co-designed, widely accepted definition of what good looks like, that we will co-produce with people with lived experience, with partners. It sets a really clear expectation of what we expect from providers across sectors, a clear expectation for people drawing on and choosing services, those commissioned services, and for us to regulate against as well. And it follows in the footsteps of right support by care by culture, which is statutory guidance for the delivery of services for people with a learning disability and autistic people. And of course, we recognize all the efforts that have gone into raising the profile and research of dementia by different organizations. But as the regulator, we have a unique view of health and social care and a unique role in it to bring those efforts together and to make that definition of good a reality and to drive those collaborative improvements. For us, this work fits perfectly with the immediate priorities and the foundational improvements, and actually enables our journey to become that effective regulator we want to be. And that is without impacting our ability to carry out more assessments. In fact, it will help us to increase the quality of our assessments. And as a real cross-sector piece, as you were saying, Mike, this has really got the opportunity to bring together the chief inspectors and directorates on a really important topic to work together, to keep our focus on people's experience, from GP practices to outpatient departments, to long-term decisions about care. And then finally, it really speaks to CQC values and what we're trying to achieve through the CQC way. Listening to people and partners, building those trusting relationships, increasing the confidence and capabilities of our own teams, improving the effectiveness of our assessments and our regulation is at the very heart of it. So we really welcome your questions, but also your support for us to formally unpause this work and to really get going with it.
Thank you very much indeed for that. Jo, did you want to?
Just open for questions, really. We're really keen to be able to answer any questions that you have.
So while people are thinking up their questions, just a comment from me. One of the things that I heard loud and clear during my review in the autumn was across the sectors the need to redefine what good looks like, and I think this is going to be a major priority for the organisation, the chief inspectors, but throughout the organisation. And you've also eloquently said that's not just us, that's co-design, co-production of that, but it was a major request, I think, from all the sectors I talked to at the time. So who would like to have a go first? Yes, David.
Thanks very much, Mike. In my standard declarations of interest, one of them is that I'm the Executive Chair of Dementia UK, so just mention that in case colleagues have already forgotten that. And it's on that I wanted to ask you, obviously welcome what you've done. We have some 500 Admiral nurses who are specialist mental health nurses, experienced and trained in dementia care. And the model that they adopt, which is different to Alzheimer's Society, etc., is that all the advice that they give has to be clinically based. In other words, it has to be demonstrated that there is a clinical underpinning for any recommendations they give in the nature of what good care, as Mike has termed it, actually looks like, as opposed to what I might think good care looks like. So what is the clinical underpinning? So it's really an offer to you to engage with our nurses, because they are on the front line of dealing with the families as well as the individual who has dementia, but the families who are affected by the care. And that's affecting goes straight to the heart of one of the government's priorities, which is getting people into work, keeping people in work. And, you know, as you've found, a lot of carers either limit their career aspirations, and that's discriminatory because a lot of those are women rather than men, and that puts an artificial kind of self-imposed glass ceiling on their capability of delivering to the economy and delivering the self-actualization of occupying senior roles. So this is really critical in all sorts of different important agendas that the government has as well as we society. So just finishing, the offer is there. Come through me, engage. We will give you every assistance necessary. But I think there's a lot of rich frontline learning that might be helpful. Thank you.
Yeah, thank you, David. And I'm pleased to say we have already got some really good connections with some of those Admiral nurses, and we have been speaking with them, which has been really valuable. And important to say that the statutory guidance that we're looking to produce will be very much based on research, and we have a literature review that is starting to make sure that we're reflecting all of the best practice and all of that kind of clinical guidance, as well as social research based guidance as well. So we'll be looking to engage with lots of people and get that included.
One of my trustees is Alistair Burns, who was the previous dementia czar, as you know, and I'm quite sure, and I carry from Alistair, you know, a very willingness to contribute, if that's helpful to you.
And I worked alongside Alistair for many a long year in a previous
As our
role.
chair has said, worked closely with Alistair Burns. But you have there, you know, somebody who's been, you know, at the forefront of the policy area, as well as bringing his own medical and clinical knowledge to this, and now his practical experience of how care operates in the community and in all the settings that we cover.
Quite like to bring Julian in on this as well, and the questions in my mind, which for all of you, is do we have some idea of timescale for developing this guide? But Julian, do you want to say a word first?
Thank you, Mike. And I too wanted to touch on that point about timeline. So, I mean, really good to see this, and I think a very important set of activities for us to do. And I was pleased to see how you framed it in the context of the work we're doing to rebuild the immediate priorities, foundational improvements. That's really clear. I think it's good to see that, and indeed, Mike, with the board's agreement, the next steps around sharing a work plan for approval by the exec team, which then enables us to have that statutory guidance ready for Dementia Action Week at the end of May 26. So there's a good, I think that feels like a good timeline to really build this in terms of not consuming disproportionate resources in the short term because we've got a lot of work to do, but equally giving it the right level of priority at the same time as we develop and rebuild. And I think getting that right is going to be a conversation we'll have together, but I'm sure we can do that in the context of the level of sort of instinctive support and encouragement around this. So I think the proposal on timeline in the paper, Mike, looks sensible from our perspective, and obviously we can come back and report back to the board once we've done more work with colleagues on the detail of the work plan looking ahead. But thank you.
Yeah, could I just add to that we've spoken with a lot of ops colleagues as well, and obviously very mindful of pressures with other work. That timeline we can have some conversations about sort of the practicalities of that. But operations colleagues are telling us that they're really, really keen to get involved in this, and we have masses of expertise in the organisation around good dementia care. And we see very much this piece of work involving a core group to steer this, but bringing in different expertise both externally and internally as and when we need to. So we don't think it will consume massive amounts of resources during the whole project, and we can be sort of very flexible to work around how we bring that in.
Chris, I think you had a question.
Yeah, look, really welcome this, and just from the organisation, the local authority I currently work at, when this landed, it had real sort of leverage really within our organisation, which I think is a good reflection of what we had. And and actually something around best practice that comes from the regulator has an inbuilt sort of cachet with it because of a kind of sense of the authority behind it. So really to be welcomed. I think there's a really significant bit of work around the quality of commissioning of quality dementia services and pathways, and that's quite variable. So looking at that, so that links to local authority assessments. But most importantly, I was really pleased to talk about the training and skills that need to be given to people working in care providers. That's probably the most important thing. But there's some excellent practice out there that you've highlighted, and if the more that we can sort of bring that out, showcase it, the better. Because I think the answers are out there on some of that, but it's just being really clear that both commissioners and providers understand that and can look to sort of deliver that at scale. So I really welcomed it. I think it's a good example of the role of a regulator to promote good practice, set clear standards and guidelines, and that'll drive practice up across the piece.
Thank you, Chris, for that encouragement and that feedback as well. And I think that is what we've heard. It's setting those guidelines, but I think the other side of it is this element of co-designing this together. So it's not going to be something that we as the CQC think this is the right thing. It's going to draw on the rich evidence and experience that's already out there, the research, bringing it together, but bringing it together with the voice of people and our partners to really set out that rich evidence base that really supports what we are saying. This is what good needs to look like, and those clear expectations for commissioners of services as well as providers, of course. And you're absolutely right. And the report does highlight where there is good practice rightly. What it highlights is it's not consistent enough, and that's why we need this work, isn't it? But yes, it's absolutely right that we shine a light on where there is good practice and then say, let's do more of that across the sectors as well. I talked about the hospital's experience in one of the examples, but of course the report also highlights where that has gone well, where there is potentially use of quieter parts of wards to really provide that person-centred support as well. So thank you.
Thanks. Aaron.
Thank you both. Just to echo comments around the room, very supportive of the work, and I think it's really important. I think you were making the point about pathways, and Chris and I were earlier reflecting about the importance of cross-sectoral working on particular areas like dementia. So that's a really good example of an area where we can work across the inspectorates to make sure that people are getting good care and that we're promoting good examples where we see that. I suppose, as well as the work towards the guidance, I think we could start to think about how this informs the assessment framework and the work we're doing around quality statements already, because there's so many good examples that you've already drawn out that we can start to think about how we embed that within our approach to the assessment framework and the quality statements. So it's an offer, and we can chat about that further. But certainly James, Chris, and I can have a think with you as well about how we embed that. Thanks.
Go to Dan first, and then Alex.
Hi, Stefan. The Quality Networks really welcome the work that you're doing, and as you probably know, the Carers Network are a fundamental resource because among us there are many, as what we call carents. We're also part of the sandwich generation. I really welcome what David said about the financial penalty that so many women pay when we become carers. For many of us who are part of the sandwich generation, it's a really difficult balance. A few things that have come up for me is that dementia is very much an umbrella term for several different conditions, and again, as David has already mentioned, Alzheimer's is just one of those. So I was wondering if that is going to be brought out, because the different dementias present very differently, and in terms of GP access, one of the things that we note is that, you get a memory assessment if you're lucky. Well, that's not necessarily relevant for different types of dementia. So we need better GP care in that regard. But also in terms of getting the information that you need. I know you've gone out to consultation. The LGBT group did a really good session on trans, and an excellent question was asked, and a really good answer was given within that about caring for trans people who have dementia. So I'd recommend that you make contact with the person who gave that really, really detailed answer in that regard. But in terms of getting feedback more generally, this is just a point about my own experience of Give Feedback on Care. Give Feedback on Care, while a good tool on our website, does not enable us to give feedback on pathways of care. I have to go in and I have to pick a service, and so that means that I would have to do multiple entries to give an experience of a pathway. It's laborious and it makes people give up. Is there any way that we can give feedback on care where we can actually say, these are the pathways, these are the people that were involved in the pathway of care, and this is what happened? Because it is extremely difficult to do that, and I know that I've given up because it's, how do I do it? And it's laborious.
Thanks very much, Diane. I think you've just added to Esther's workload, which is, but she's taking it on the chin. I can see that. But there's also the point, back to you, Stefan and Joe, about different types of dementia, for example.
Yeah, thank you, Diane. That's really helpful. Absolutely. Dementia is an umbrella term, and it covers a different range of dementias, and I'm always very keen to talk about people with a dementia rather than that other label of dementia. We've included already as our stakeholders in people we've been having conversations with various different organisations that champion the care of people with specific types of dementia, such as Parkinson's UK, the Lewy Body Dementia Society. So there are various different organisations that we are already speaking with. One of the things that we have been doing already so far and have continued to do is look at how we improve our dementia training for our own staff in the organisation, and that training is really, really valuable in supporting our inspection teams to understand the different types of dementia and the different types of specific needs that people might have as they go through that journey through the pathway of care and support. So yeah, really, really important that we capture all of those different experiences. And just to pick up on a couple of other things that you mentioned, you were talking about intersectionality there, and that's a very big part of our work in the statutory guidance, is to make sure that we're thinking about what it's like to experience living with a dementia and perhaps being from the LGBTQ plus communities, perhaps being somebody who is a black older man living with dementia in a deprived area with really poor access to primary healthcare support. Really, really important that we include all of those voices when we're gathering our evidence for building that co-produced guidance. The other thing I just wanted to mention was that agree with you about understanding the pathways through the give feedback on experiences of care. One of the things that we already do, and we have been doing really, really well for the last 18 months, is building our how we understand people's experiences of care. So we've been working really hard to promote the use of our Sophie observation tool over the last 18 months. And for those of you that may not be aware of this, this is a research-based framework that allows us to understand what people's experiences are when they can't tell us, when we're going out and doing assessments. Really, really valuable tool that's really, really person-focused. We've been working hard to increase the use of that, so therefore improve the quality of our assessments in adult social care services, but also in hospitals as well. Anything?
Thank you. Can we go to Alex next and then Chris?
Thank you, and echo what everyone else says. It's a really great piece of work, and thank you, Stefan, for some of those comments from reflecting the comments that people gave you at the beginning. So it really kind of brings it to life. I mean, I agree with Mike's point that this is something that touches on all four of our new chief inspectors, and there's been a lot of commentary recently that the role of CQC in the future is about assessing those gaps in care and the quality of the intersections rather than the providers. I think it was the first question you got asked at the Confed, Julian, and at your session about how we're going to do that. And it just strikes me this might be a piece of work as we take it forward that is one of the pathfinder pieces to challenge ourselves, that rather than, and to your point as well, Dan, rather than going by unit of provider, are we assessing those gaps and helping those gaps kind of, there be, excuse this phrase, quality of care within those gaps as well as just within general practice or wherever else it is.
Chris?
Again, really supportive of this work, really important to the organisation. Just a couple of things. I agree with Aaron's point about I think it should and could inform our thinking around quality statements for providers. I also wonder, and this links to a wider point, whether sometimes examining what creates the right environment, not just for an individual organisation, but for a system to work well. And I think there's something really important for us in trying to understand not just what individual organisations do well, which is really important, but also what lies behind that in terms of the way in which organisations work together, the way funding flows. And I think uncovering some of that would probably help us to be better partners for trying to drive change and improvement. So individual organisations and what they're doing is absolutely vital, but I do think being inquisitive about what's the wider environment in that area that encourages that to be the case. And just to link that point to the point that was made about following people's experience of care, I absolutely agree with that. In some of our other work recently, we've deliberately chosen to follow people's experience of care over a period of time, and I wonder whether this might lend itself to that type of work, where we're looking at domiciliary care at the moment about people's experience of care over a period of time, and I do wonder whether we could think about using something like that to sort of track over time people's experience of the local systems of care that they'll use.
Back to you, Stefan.
Can I come back? Thank you, Alex. Thank you, Chris. I think for me, this is a really important piece of work to actually activate all those levers for improvement we have as a regulator. We are talking about the statutory guidance as the centerpiece because it is, well, at its heart, it's directive, it's anticipatory, but it's also going to be a co-produced piece of work, of course. But it's, for me, the centerpiece and the start to much more. If we can define really clearly what good looks like and have that widely agreed, that's just setting a line in the sand for everything, isn't it? What then flows on is actually how, like you said, Chris, how does that link across local authorities, across systems? What else can we say in this space where we might have to use our other influential levers of stakeholder engagement, etc. So for me, it's the centerpiece, but there is so much more we can do with this to see how things link up from there. But currently, we really need to take that role. We've got that unique role to actually bring all those efforts together to get to a point of saying, this is what good looks like, setting that out clearly, and then really thinking what other regulatory levers of improvement can we engage. And I think this is the perfect piece to do that.
David.
Thank you. Sorry to come back again on a point that you raised. I think you mentioned at the beginning that you were going to carry out a sort of, or produce a compendium of relevant research. Was that right? Did I understand that?
Yes, we're doing a literature review.
Good. Then I can ask my question, if that's all right. When we produce national guidelines at NICE, we typically look at something between 5,000 and 8,000 research papers from around the world. And one of the reasons that we look at so many is because there's quite a lot of stuff produced that is not produced in this country, is not produced in America, where you might naturally look, but is produced in other countries that have different cultures. And one of the things we do at NICE is to say, okay, that's what this piece of research from Japan, let's say, shows. Is that relevant to the way in which our systems operate, in which our culture operates, etc.? And we will narrow down that enormous number of papers to the ones that seem themselves to be good research, really excellent research, reproducible research, but also those that bring in ideas from cultures that may not be the same as ours, but we can sense a relevance, or we can sense a relevance to subgroups of our society and our populations, etc. So in doing that, if we are to produce something that will be seen as this is the almost, you know, the kind of approved research, the acknowledged research, are you able to go through that kind of process that we go through at NICE, or is that just too much to ask?
So we have research partners commissioned externally to do that, David, and happy to pick up a further conversation in more detail. So we're working with IFF and Leeds Beckett on this, and they have produced an initial catalogue of research they want to look at.
Well, if I may, I think perhaps discussing it with some of us at NICE might be helpful. It might shortcut some of the stuff that you do. Okay, thank you.
Melanie.
Hi, Stefan and Joe. Hi, nice to see you. Yes, really welcome this. It's absolutely crucial. So I'm hoping the board will approve it because it sounds like there's that mood in the room. So what I'd really like to see in the work plan is just pushing that bit about inequality, because we know dementia, there's a protected characteristic of age and a long-term condition and mental health. So I'm really keen that we get into that space about just driving what will the statutory guidance deliver for individual outcomes, as well as some of the wider stuff we talked about pathways and systems. So I'm really keen to see that we get to that stage in the work plan, because I think that for me there's just a little bit that missing from the strategy on a page was just about impact. But yeah, I really welcome the work. I'm really pleased to see it, so thank you.
Any other questions, comments people want to make? If not, I think what I would say is I think you've heard the very broad support coming from the board. This really matters. So we are encouraging you, I think, to get on and start developing this guidance, but working with all the people around the table that you've already heard from, and of course others, and taking account of whatever is best practice in other parts of the world, as David has said. So quite a big job for you, but we all think it's really important.
Thank you very much, colleagues. Thanks for your time. Thank you.
Thank you.
We are running ahead of schedule, so I think we could just take a 10-minute break if people would like that. And those watching online, in 10 minutes, and we'll be back to keep going. Yep, we're on. So, welcome back after this break, and then we've got an important item now, which is on the Trade Union Equality Networks update, and Diane is here in the room with us, and then we've got two people online who will come in for the trade union in just a minute. But shall we start with you, Diane?
Yep, can do. Right, so as I've already said before, I am the Equality Network Chair for the Gender Equality Network, but when I come, I represent all the networks. So an update from the Gender Equality Network is that we now have 2 new co-chairs of our network, because our workload has increased, because one of the things that was a priority for us was to review the maternity policy within CQC. That has broadened quite massively now to become a parenting policy review, because we've realised after working with the QI team that there are some fundamental changes that we would like to make, and we would like board support with that. We had a day where we brought together some members, and some of those people were quite senior leaders in the organisation who had experience of various different policies, and we found out that apart from the things that I'd identified within the maternity policy being missing, as in nothing mentioning baby loss in terms of miscarriage, there not really being anything about neonatal care, which will be added shortly because that's a new statutory requirement. There were various other things about that, but what came clear through this away day is that our paternity leave policy, although fits within the standard, the UK is one of the worst in Europe and in the world in terms of how much we give for paternity pay, and one senior leader did outline why 2 weeks simply was not enough, especially when you experience a traumatic birth. and there are complications because not every birth is standard and straightforward. We had parents who had experience of the adoption policy, and they went through it really thoroughly because we mapped it all out, and we realised that that is now quite out of date because it's fine if everything goes swimmingly, but these days baby adoption is very, very rare. It doesn't mention foster to adopt, and most adoptions now are older children adoptions, which are much more complex. Children are often very, very traumatised when they're coming to adoptive parents, and there are certain things within that policy which we could very easily change, but we need to also ask for some fundamental changes, because one of the things that is missing is failed adoption. Failed adoption, it was highlighted to us, is as serious as baby loss, because of all the steps that lead up to it. And unfortunately, we do have evidence that within the organisation, somebody did actually, unfortunately, end their own life when a adoption failed. And their manager did everything in their power to support them, but unfortunately our policies do not always allow managers to know what they can do and can offer, and so hands can be tied with regard to things like that. And we keep hearing over and over again, generally across the networks, that we call it the manager lottery, but sometimes it's a case of the manager will say, take all the time you need, and then actually that's not the case. The person can't take all the time they need, or the manager isn't fully aware of the policy, and so somebody going through a different situation has to review the policies themselves and go to the manager, and it re-traumatises them and things like that. So we are working with the Academy to prevent such situations from happening, but we also need to make sure that our policies are as clear as possible so that managers can get the correct and consistent advice and give good support to people. So we also learned that in terms of shared parental leave, it is so complicated to do it. Some people have actually looked at it and just gone, do you know what, I'm not even going to bother. So that means dads are missing out, or the non-birthing partner in same-sex relationships is missing out, or the person who's not regarded as the primary parent in same-sex relationships is missing out, because it is so complicated, especially when two people do not work in the same organisation. So there are some ways in which we are going to push forward with that. So obviously it's quite a big comprehensive suite of things, and we are going to be asking for some changes that may require board approval, because there are changes in terms of how much leave people can get, in terms of what pay people can get and things like that. Other things that the networks have been hearing is again about recruitment. I know I've already touched on this before, but it goes beyond inspector recruitment. We've been looking at it quite generally. As a joint network group, we have been pushing for change for 2.5 years now. Change has unfortunately been very, very slow on some areas where we feel that there can be some quick wins. Yes, we know that there have been 2 external reports done, but we are yet to see the change materialise from them, and those reports were given to us late last year, and we're now in June, and we think that, you know, potentially there are changes that can be made there. We're also hearing that in terms of progression, I know that Simon mentioned this before, progression routes within CQC to a certain extent don't exist. People do feel that they have been held back, and I know that recruitment is always competitive, but we are hearing that there are still a lot of interim appointments, and they are lasting for a long time before people get made permanent or are pushed back. So there are issues with that. The final thing that I would like to raise is that at a recent staff forum meeting where a lot of the Equality Network chairs go, and we have representatives for staff forum from all over the organisation joining. There were concerns raised around from policy around the review of the assessment framework, and the fact that there's a lot of internal and external engagement going on, and that's absolutely brilliant, but there are concerns around what's happening internally and how staff are being able to input into that. So those are the things. Sorry if I took up a lot of time.
Can I just add to what you might ask of you, which is, because we've got a lot of people who are new to the organisation, can you say a little bit about how the equality networks actually work? Because I suspect some of our colleagues don't know. Okay, so we have a Disability Equality Network, a Carers Network, the Race Equality Network, LGBT and the Gender Equality Network. Basically, we try to be independent of the organisation and invite members to join. Members don't have to be of that particular grouping. We encourage people to join as allies. So what we do is we have members meetings where we try and discuss issues within the organisation that are of importance to our members, but we also try to run learning events so that we can promote information across the organisation to help how we carry out our work. So one of the things, apart from the maternity work, that the Gender Equality Network is trying to do is to promote an understanding of the fundamental misogyny that lies at the bottom of a lot of healthcare, and particularly historical misogyny within mental health care. So we're trying to raise the voice of things like that, and so we'll get carers trying to raise the voice of the difficulties of being a carer at work, being a carer within CQC, and how we can improve things. So, and then we come together as a joint network voice to discuss, are there things that we can push for together as a whole group because they're affecting everybody, or do we need to work on them individually? So we each have our own aims for the year or over 2 years, and we try and work towards those. So as I've mentioned before, our core aims within the Gender Equality Network at the moment are for improving the maternity and paternity parenting offer within CQC, but also to raise people's confidence levels within CQC, because there are areas where women's confidence is often knocked back, and the evidence shows that anyone who's been out of the organisation for a year or more, so if you've taken maternity leave that's lasted a year, your confidence is knocked, and it takes a long time to get your confidence back, and that can affect your progression. We work with the carers, as I've mentioned before, because of how there is a penalty usually on women because we're forced to go part-time. We work with LGBT because of trans issues. So we do work with all of them. And again, we work with DEN because a lot of disability issues, again, disproportionately may affect women. But we also, although we work a lot on women's issues, we do look at issues to do with men as well. So the increased suicide rates around men, because we try to work with that. So we work with LGBT because that is an additional concern within there. So we basically work quite well together and have those things. Dan, thank you very much indeed. Before we move on to the trade unions, are there any questions or comments to Diane, and then we'll come on to the trade unions? Yeah, Esther.
Thanks, Diane. And just, really helpful to hear about the work of our staff networks. We spoke about this earlier, but the important work they do to support our colleagues in this space. And I know at our last board meeting, we acknowledged that our new executive team would mean a revision in the sponsorship arrangements for the staff network. So I know that's still work in progress, and it would be really great to get that in place. Just a comment on your work around paternity, maternity policy. As you know, I have lived experience in this area, having gone through shared parental leave, which I agree is a real minefield. It's really challenging, and an adoption process which is never certain until it actually happens. And so, the support that we can give around that feels really important. And also links, I think Julian and I and other colleagues from the exec team led some calls around Carers Week, where we reflected on how important the role of an employer is in supporting our colleagues with work-life balance and important life events. And so that feels like a really important step forward, and really supportive of that work. So thank you.
Thank you, Chair. Thanks for that, Diane. I just wanted to mention that in my experience in this area, some of the most enlightened policies that I've seen in large organisations are in the legal profession and in the accountancy profession, who seem to have got over that problem of that you've referred to as misogyny particularly, but also because they've put so much resource into the training of people, and they just don't want to lose them. Therefore, you could say, well, it's a defensive move, but that doesn't matter. But the fact is that, some of the practices that they've got to protect the individual, to produce something, even though it's a large firm, that is tailored to that individual, is quite impressive. So if you haven't already looked, I would recommend a look at some of those.
Thank you. If you could pass those on, because when we developed the maternity policy, menopause policy, one of the things we did an external look at what policies were out there, and we looked at the civil service. Gloss over that. And what we actually did was we found that the University of Glasgow had a really good policy, and we looked at that. I would also be remiss, and because I did promise I'd mention this, that as part of the parenting suite, we want to review the fertility policy as well, because at present, people who are going through fertility treatment don't get paid leave for their appointments, and that can be an additional stress, and we feel that it is not parity with appointments for when you're having antenatal appointments. So that's a piece of work. But thank you, David.
Chris.
Thanks. There was 2 points I was going to make. Diane, did you say a colleague had taken their own life? If you did, I hadn't heard that, so I just want to acknowledge that, and that's really sad to hear if I've heard that correctly.
That's historical, but it was around a failed adoption, yes, unfortunately.
Okay, that's not good. The bit I was just going to talk about recruitment again, obviously talked about before, but the wider recruitment. I should have said more on this before, but it's probably something we need to do, and I can pass on to Jackie and team to get back into the networks and update on a lot of work happening, and there's probably just more need to shout about that. There's been a lot of work with external providers and looking at how good a best practice approaches, looking at values-based assessments, looking at how we can do better forms to include, get feedback, and generally how we can get better diversity and inclusion on recruitment. So there's a lot of activity happening, but I think we just need to look at how we connect up and celebrate and shout that and get feedback on it.
Julian.
Thanks, Diane. Really good to hear from you. Just to say, Mike, your question about and Diane's response around the role of the equality networks in the organisation, I've been really impressed with the work that all of them are doing, and in fact had the opportunity to spend time with each of them. We are looking at how we, maximise and use the expertise and energy from the networks in the work that we do as an organisation. I'm sure Chris will have noted the key points around policies and so on, Diane, and just to say that we're looking increasingly as a team at how we make sure that equality networks and indeed trade union colleagues can be part of some of the work that we're doing that we've talked about today in terms of gathering the feedback and also the co-production around where we're going, and useful to hear your point about the assessment framework as well, which of course is a very live and immediate issue that we want to get right. So appreciate that. Thank you.
Okay, I think at this point we can move on to trade unions, and welcome again to Sue Seska and Dee McAvoy. Who's going first? Is it you, Suze?
Me.
Good, over to you.
Hiya, thanks very much for inviting us along today. It is a genuine pleasure to be here. We thought we'd start out with a little bit of an introduction about who your unions are, as it's often talked about the union or the unions, but we want to make it very clear that we are here and represented in the 6 recognised unions at CQC, and I'd like to name them. So they are Unison, the Royal College of Nursing, RCN, Public Commercial Services, PCS, Unite, Prospect, and then we have the Royal College of what's RCM? Maternity? Midwives, sorry, I always get them wrong. So that covers our MNSI colleagues, and so they're an umbrella organisation, so we don't work as closely with them, but we just want to make sure that we name them, as myself and Dee both have members in MNSI as well. So we wanted to just explain that we work collaboratively with across the unions. I've only ever been a union rep at CQC, but I'm told that this is quite unique across local government and the health sector, and I think CQC really benefits from that collegiate approach. We're a diverse range of colleagues and membership, and we have a lot of benefits to bring. We want to really ensure today that we're not viewed as just one union, and that as much as we very well organise for the benefit of CQC, there's a lot of things that have to go down to an individual union level. Dee? You're on mute, Dee. Often a thing I have to tell you about.
I'm sorry, it's so sticky. Hello. So as Sue says, I'm Dee. I'm the lead for the Royal College of Nursing, and I wanted to extend a thanks to Julian and Mike for giving us the opportunity to be here. It feels really good, really inclusive. I think we have a really important role here. The joint trade unions at CQC, we're often described as a critical friend, a canary in the coal mine. I think we like to think of ourselves as a trusted partner. We're very active here at CQC. We have quite a close relationship with our membership. We have regular engagement, so we hear unfiltered feedback, really valuable. We're a very experienced group of trade union reps, and we have fantastic full-time officers and extensive resources from our individual trade unions that we can call upon and do call upon. And our basic aim really here is to work with our senior leaders, with Julian and Mike, Esther and others, to address the issues that are arising and to find some solutions. And we feel we've really moved into a much more positive space in terms of that. I think, Susan, I was just going to give you a brief summary of a couple of things that are important issues and issues that are maybe impacting on our members currently. So I think first and foremost to say that our members are absolutely committed to delivering our purpose and rebuilding the trust in our regulatory approach. That's why we're here. We have amazing people who work in this organisation. They want to deliver our regulatory responsibility. They want to do a good job for people using services. And that's been very difficult because of the tech and the workforce issues, which are now being addressed in an inclusive and safe way, considered way. And we're very grateful for that. I think the second point I'll make is around the work that we're doing to improve equality, diversity, inclusion and accessibility within CQC. And just as Diane said, we also have a policy subgroup trying to influence and shape those policies, benchmarking with others. And what we're really interested in is looking at how we
Oh dear, I think you've...
Is he frozen?
In this area.
Yes.
But we're not. But we're not quite there yet. And so that's a focus for us. Leadership.
Dee, we're losing you intermittently. Shall we go back to Sue's?
That we're clear about our responsibility.
I'll let Dee know our connections.
Sorry.
You keep cutting out, Dee.
Oh, have I gone?
Yeah, we'll get you back, but let's go to Sue's now to say a bit more, and then we can bring you back. Hopefully the line will be better.
Sorry, Mike.
So yeah, the points that I wanted to share, I think it shows a very collegiate approach to things. As that the CQC way is eagerly anticipated by all of our members, and I think that it'll provide a lot of healing that some people need after quite a turbulent 2 or 3 years. But mostly it'll help us to move to a more positive working environment. And we think that the board will be pinnacle in this. I think what we'd like to share with you as a board is that how we do this and how we get this right will matter. There's a lot of weight being put on the CQC way to fix a lot of things. And so it's often in the detail where we need to look and get things right. It's the small stuff that impacts our members rather than some of the bigger things. It's how we do things that often has more of an impact on people's general day-to-day feelings at work and how it feels to be a CQC employee. And the third thing I realised we've started on our first was just that there's a lot of change afoot, and it provides not just external scrutiny, but there's a lot of internal focus on, again, how we're doing things. And I just wanted to sort of echo that whilst our members have been through a lot, they are very much solution focused and trying to support all the change and improvement activity. And we need to be mindful that it's our members who go out and engage with the public and providers on that sort of soft local level. So all the great stuff that we do with public engagement centrally can only be strengthened by empowering our staff when they are out in public and engaging with providers to be able to talk about our organisation positively and the things that we're trying to do. It does feel like we're in a very different place. And as personally, as a CQC employee, that feels refreshing. And so we just need to continue that momentum. And the last thing I was going to say is that me and Dee are very approachable. So if anybody would like to get in touch with us, talk about how we can work together, how we can support things, how we can liaise with members to support some of the initiatives underway and the improvement and recovery activity that we're already linked into, please don't be shy. We're friendly and we're always willing to sort of discuss how we can serve our members who are also CQC employees. We're on the same side. We're all trying to do the same things. So work with us. We're here to help. That's all. Thanks.
Thank you very much for that. I don't detect shyness as being one of the problems around this table, so you're all right on that. We'll go back to Dee. Dee, I'm afraid
Mike.
you froze, but let's see how it goes.
Yeah.
If it does go off, you might want to turn your camera off. But let's see how it goes.
You were just talking about the policy stuff, Dee, by the way, if that helps to pick up where you left off.
I was going to say, I don't know where I got to. So that was around the improvement work around our equality, diversity, inclusion and accessibility and putting those policies into action, really. I think that's where I got to, and delivering those outcomes for our people. So the bits that maybe weren't clear were, that our leadership, that we've got clear intent from our leadership behind those policies so that they're delivered, clear responsibility throughout the organisation for the delivery of those policies, and that then we've got very clear arrangements and escalation points where we need them in those policies, and as Diane was saying, the trade unions, we have our policy subgroup also trying to mould, influence those policies and ensure that they're person-centred. We use person-centred a lot in our work, and we'd like to see that in terms of when we're talking about our people as well. So I think that was it for me. I don't know if there are any questions. I hope you heard that, Mike, Julian.
We heard that very clearly, so thank you very much indeed. But I'll now look round the room here to see if people want to ask any questions or make any points. I think it was all very clear. And the most important bit is we want to work together. And the CQC way will be fundamental to that. And as you will have heard earlier in the meeting, it is not very long now before the formal launch of the CQC way. And I think what I can also say is that we discussed it at yesterday's private board, and there was strong support for this around the board table. So the board is engaged in this as well as others. Any other specific points? Julian, anything you wanted to add?
Well, just to thank both Dee and Suze, and also the wider group that you represent, and having had good sessions with the JCNC, and indeed I think the maturing relationship in terms of frank and open conversations about our shared challenges, and I think that feels important. It feels like a very clear, respectful and open discussion. And I think the point that was made, I think you said it, Suze, about partnership is one that I think we want to role model in our work together. And it feels good having you as part of this conversation around the board table. So thank you both, and look forward to working together on the many challenges that we all know we face, but hopefully can make good progress. Thank you.
Thanks, Julian, and my thanks to the two of you, and also to Diane for your part in this. So that's, I think, a really useful discussion. That, I think, takes us into any other business. First of all, is there any other business around the table that people wanted to raise? If not, we do have 3 questions that were posed by, I don't know who, but people outside. I'll read out the questions, but fortunately I've got other people lined up to give the answers. So, question 1. When members of the public report concerns to CQC via the Newcastle Centre, how are they informed of a follow-up? Chris.
Well, first of all, thank whoever the questioner is, thank you very much for the question. I just want to say that the value of people's feedback can't be overstated. We had 130,000 pieces of feedback on care that informed inspections last year, and it's a key part of our success now and in the future. And I regularly speak to people who provide that feedback, and I know how, first of all, how hard it is sometimes to provide that feedback, and how important it is that we support people. So at the moment, you can sign up to receive alerts on organisations where you've offered feedback to CQC, so you can see when we've taken action against an organisation. But we know there's much more that we want to do, and it plays to the conversation we had earlier about data and technology. We do want to do more. We want to be able to provide systems where first of all people can directly know when their data is being used as an automatic feedback loop for people to receive that information. We've piloted such approaches in the past, but it does relies upon a couple of things. It relies upon colleagues, inspector colleagues, making sure that they understand how and when they've used that information, and as you can imagine, it relies upon their technology to make that feedback possible. I do think how we record that information on the system and how we use it to then inform people of use services is really, really important, but it comes alongside another group of things around our assessment process that's also important. So I think it is part of what we want to do. It also, for me, links to our work with teams locally. So how we work with operational teams, work with people who've given feedback, and also organisations that offer it on their behalf, people like Health Watch. So I'm really keen that we rebuild those relationships locally as people go back into their sector specialties, and that we make sure as part of our redevelopment of the technology that we consider that important element of feedback.
Thanks, Chris. So it's a work in progress, basically. So question 2, this is coming to you, Aidan. What is the frequency of dental practice inspections currently?
Thanks very much, Mike. So we're responsible for inspecting and assessing just under 12,000 locations in the world of dentistry, and the historical aim has been to try and inspect about 10% of those a year. Our average age of inspections at the moment, which has been increasing, is just over 5 years, so clearly we want to do better on that. The observant amongst you will have seen in the business plan that there is a target of 1,500 inspections by September 26. Currently, if you look at this year-to-date financial year, that is, we've inspected about 2.1% of the estate. That's 241 inspections, which puts us on target to meet that. And if you then have an annual rate of 1,500 inspections a year, that would equate to inspecting about once every 8 years. It is important to point out we don't rate, we give a compliance outcome for dental practices, and importantly we respond to concerns and risks, so we will inspect on the basis of risk and concerns raised in addition. All of this is subject to review as we look at scheduling and so on in the future.
Thank you very much indeed, Aidan. Very clear on that one. So question number 3, which is coming to you, Aaron. What arrangements are there for inspecting, arrangements for accommodating patients with mental health conditions?
Thanks, Mike. And I think the first thing to say is just to acknowledge the importance of that question. In my experience, patients, people with lived experience, carers, will often see things that those of us who've worked in services might not notice. So I think it's a really important question. In answering the question, we use an organisation called Choice Support to access our people with experience, so the experts by experience. We aim to involve them in our inspection activity. And if I can broaden the question, as well as the inspection activity, both on-site and off-site, we also involve them in the work of the Mental Health Act reviewers. So they also join the Mental Health Act reviewers. There are difficulties. There are issues around logistics, making sure we've got the right person with the right experience for the service that we're visiting. And there are some logistical difficulties as well. In acknowledging that, the teams have informed me that we've actually got a working group set up for next month, which is actually going to look at just going beyond the inspection and the review activity to how we involve experts by experience, patients, people with lived experience, carers, in setting the strategy and the priorities for the mental health sector and team. So that's the work that we're doing at the moment. Thanks.
Thank you very much indeed, Aaron. So this is clearly very much on the agenda already, but will continue to be so. So those were the 3 questions we had from the public. Finally, any other business that anybody wants to raise? If not, I will just say great thanks to everybody around the table for both the presentations they've given, for the papers behind it, for making my first public board meeting relatively straightforward. So thank you all very much indeed.